I think they have, at best, a 50-50 chance of passing this bill. To get 3 senators to vote no, you can say yes, you can say no. It's probably 50-50. But the bill is just devastating, and that's what's making it so hard for them to pass it.
See, right on the 50-50 thing. Joining me right now, syndicated radio host Buck Sexton and Bustle.com senior political correspondent Aaron Delmore. Good to have both you guys here. Buck, I'll start with you. There are, granted, some things in here that a lot of traditional conservatives don't like. However, the reality is they need to do this if they are going to do other things, specifically tax reform and an infrastructure bill. So where do you come out on this? Are they going to be able to get it done? Are they going to be able to bring some of those stragglers along?
I think Chuck Schumer's right in that it is about 50-50 at this point. If this is viewed as a step to many more things in the agenda, then getting it done quickly and going forward, I think, makes a lot of sense. This is not repeal, so people should just understand that right off the bat, and anyone who's saying that it is a repeal of Obamacare is not being entirely honest with himself. The best stuff that
this is a modification.
This is a modification of the Obamacare law that does do, from the perspective of Medicaid, some incredibly important long-term structural changes, which is, by the way, what the Democrats are most opposed to, I think, in this, because right now they're tinkering with not a penalty, but a 6-month waiting period. They're saying it's not an individual mandate, but it certainly feels a lot like they're trying to structure it so that people in the individual market will be penalized in some way if they go without insurance. So these are modifications, as you said. This is not a deep change from Obamacare in terms of some of the basic structural the basic structure of the law. I think we need to be honest about it. It's not as good as it could be with that, but on Medicaid, though, it is very good in the long term because it changes the way that states can deal with it.
I think you're making a fair point, and I think that it is reasonable for some conservatives to feel like, okay, this has not gone far enough. And I would argue, I mean, one of the biggest problems here is that these Republicans had 8 years to work on this thing, right? I mean, They could have come together with some, and I consider it kind of a shame that we're here at the 11th hour watching them try to get something done, and it's completely at risk because they don't have the votes, despite the fact that Americans elected Republicans to the House, to the Senate, and to the White House.
Exactly. Repeal and replace is the promise that got so many of these Republican lawmakers into office in the first place, not to mention President Trump. But now, by trying to rush this plan through, they've formed something that feels more like Obamacare light. And that's the criticism it's getting from conservatives in their own party. Now, when you have conservatives saying this isn't good enough, and liberals and Democrats, how do you
I keep going, and, you know, maybe you had me at taxes, right? I feel that tax reform is critical. It's very important. I also think that we have penalized businesses via this Obamacare project. And so if you can repeal it for individuals, sort of, if you can repeal it for businesses, and if you can move forward to get this economy going enough so that more people are employed in good jobs where they are offering health care, you'll solve a lot of problems. But that gets me right back to tax reform. And, Buck, I'm worried that that thing is at risk now.
It is if they can't move forward on this. Obviously, then also I think the entirety of the Republicans' political momentum would be in question as well if they can't get this done. But I do think that Mitch McConnell understands that by putting it in this short time frame, he increases the pressure on fellow senators to move quickly, or else perhaps then the train just starts to feel like it's derailed. So that's useful from that perspective. But this does repeal taxes, by the way. There are a bunch of taxes that in the Senate version would go away, which makes some people happy, including on the conservative side of the aisle. And it does do a lot of long-term Medicaid reform. But at the end of the day, it is now a bipartisan agreement, I think, in this country that health care is going to be at some level a redistribution of wealth from some people to other people. People don't want pre-existing conditions to be something that's barred from the market.
I know. And now it's pre-existing conditions are back in there. But, you know, let's keep in mind, and last word over to you, Aaron, what we are asking for in terms of the Rand Pauls of the world is to completely sort of gut this and start over. And realistically, as a country, we have gotten very used to the fact that employers provide health care and that we have this kind of wacky system. I mean, is there any chance where you could literally throw it all out and start over again, or is that just completely unrealistic?
Here's the problem. Some of the better portions of Obamacare, like not denying coverage to people with pre-existing conditions, letting young people stay on their parents' insurance up to age 26, those are so popular and so ingrained in American culture now. But the question is, how do you take it away?
You're 26 years old. I get it. Right. It becomes sort of an entitlement. But you're 26 years old. You ought to be out on your own with your own job and your own health care.
The more young people who are on insurance plans, the less it costs for everybody down the line. That's the impetus there to bring in young, healthy people.
Good to see you guys. Buck, Aaron, thank you so much.